Hello, my name is Ben Murphy. I'm working in the Boulder Healthier team. Today we'll be discussing keeping safe when I'm warm for the upcoming winter months as part of our Boulder Healthier Winter webinar series. As temperatures drop in winter, anyone can be impacted by the cold, and it can also cause long-term health issues to develop or underlying ones to become more serious. The cold weather brings a number of risks. As people spend more time in close contact with each other, the flu, coughs and colds are more likely to spread. The cold also makes health conditions harder to manage. It can even affect our heart and circulatory system. We're also more inclined to comfort eat and do less exercise during the winter. The good news is there's lots we can do to help ourselves and others get through this period. What effects can the cold weather have? The cold weather can make some health problems worse or even lead to serious complications, especially those aged 65 and above, or if you have a long-term health condition. It's important to get vaccinated, whether it's the flu and the COVID vaccine, depending on your eligibility. Make sure to wash your hands frequently with soap and water and use hand sanitizer. Make sure if you cough or sneeze, do it into the crook of your elbow and not into your hands. It's important to stay protected against drops in temperature, as cold weather can adversely affect the body's ability to fight off viruses and infections. Make sure you bundle up if you're going outside and be aware of signs that your body isn't handling the cold well, such as stiffness in the neck, arms, and legs. Call 111 if you suspect you or someone you know is suffering from hypothermia. The cold weather can also affect balance. Icy roads can make it easier to fall, putting you at risk of fractures. And dry winter air can suck the moisture from your skin. So make sure you use moisturizer with an oil-based to block evaporation. Make sure you shower in lukewarm and not hot water. And if you're in a cold room, use a humidifier to replenish moisture to the skin's top layer. Who's the most at risk from cold weather? The NHS have stated that some people are more vulnerable to the effects of cold weather. This can include people aged 65 and above, we discussed, babies and children under the age of 5, people who have a long-term health condition. This can include heart disease, asthma, epilepsy, diabetes, cancer, and Crohn's disease, as well as others. People with a disability, pregnant women, and people who have a mental health condition. To read more about those who are at risk, you can follow the link. You can also read guidance on the Met Office website, further support information about dealing with the cold weather. The council has a range of support available as well. The contact centres are open 9 a.m. till 5 p.m. Monday to Friday, and this supports on a range of topics, including support with emergency food, benefits inquiries, counterattacks, accommodation and homelessness, and many others. They can be contacted on 0121 216 3030. There are also 2 walk-in advice centres that are operating. The address is given. Please make sure you check the website for information about the opening times and the supports that they offer. Birmingham City Council and our partners continue to develop a range of support for residents in coming months. We've opened a range of 240 warm welcome centres that offer a range of services. And you can check more about this on the council's website and our social media channels. There's also a Helping Brum booklet that's got downloadable advice, and that's available in 11 languages. And all that's available on the Helping Brum website. Staying warm in winter is really important as well. Keep warm by putting on a coat, hat, scarf, and gloves when you go outside. We've also got advice on the council website. You can check for more advice. Make sure you use a hot water bottle or electric blanket to keep the bed warm. But don't use both at the same time, obviously. Try to make sure you have at least 1 hot meal a day. Eating regularly helps you keep warm. And you can download an Eat Well guide, which gives you more advice around healthy eating. Food is a really important source of energy that keeps your body warm. So make sure you try to have at least 1 hot meal a day and regularly have hot drinks as well. Make sure you also stock up on non-perishable goods like tinned goods, so that if you need to use those, you can do. Industry sources recommend regularly checking a heating boiler system in your home by a qualified professional, and try to do that once a year so you're ready for winter. At dusk, you should close your curtains to keep the heat in. Make sure the bedroom windows are closed at night when the weather is coldest to again keep you warmer. Babies can be especially susceptible to extreme temperatures. To reduce the risk of sudden infant death syndrome, babies should be kept sleeping in rooms that are heated to between 16 and 20 degrees Celsius. The UK Health Security Agency advises make sure you heat your home to at least 18 to 21 degrees Celsius. Ensure you have non-perishable foods, medication, and warm clothes available. Check you're eligible for help to keep your home warm. And there's a range of other advice as well available on the UK Health Security website, which is the link there. The support available as well with heating and energy costs. You may be able to claim financial and practical help with heating your home. Ensure you have an efficient heating system, which we already talked about, that you can control easily to help reduce fuel bills. You can check to see whether you're eligible for grants available at the gov.uk website and also the Cold Weather Payments website. Again, industry sources recommend annual checkups of heating and boiler systems by a qualified professional to help with energy efficiency and maintenance. You can also find other ways to improve your efficiency by checking the link available there. And you can find out more about benefits and financial support if you're on a low income at gov.uk. It's also really important to stay safe during winter. If you go outside into the wet or icy weather, make sure you wrap up warm, including wearing your hat and gloves. Wear sturdy and non-slip shoes to make sure you're safe underfoot. Use a walking aid if that helps you. And also, if you need to, feel free to ask for help or support from friends, family, neighbours, that kind of thing. If you need to speak to somebody, you can speak to your GP, pharmacist, carer, or key worker for advice. Try to make sure you keep in touch with friends, family, or your community. And look out for others this time, especially the most vulnerable in the community. If you think somebody needs help, please reach out to them, ask whether they require assistance, for example, with shopping, or just have a general chat. The other ways you can stay well as well. Make sure you stay active. Any exercise can bring health benefits. It's important to try not to be stagnant, so stay in one place for more than an hour at a time. Make sure you get up during that time and go for a quick walk somewhere, even if it's just around the house. A little movement can often help maintain strength and mobility over time. You start simple and build slowly with home-based exercises that you can add to over time. Frailty can make it more difficult to move around, and winter illnesses can have an impact on this as well. But there are ways to build resistance, and you can do this at your own pace, in your own time. Make sure that you eat and drink well, drinking plenty of water during the course of a day, and eating a variety of a varied diet, including fruits and vegetables. It also helps us to include to attain better moods and increase our energy levels, as it improves emotional and physical health. Eating well and having a healthy lifestyle helps us to feel active and brings a big difference to our long-term health. You need to ensure that you continue to take and stock appropriate medication and supplements as you normally would. And of course, we already talked about this, but respiratory illnesses are more widespread in winter. So it's important to stay up to date with vaccinations. And you can see advice around this there, particularly around flu and COVID. People in some age categories and with certain health conditions are available for a COVID vaccine this year. And also they may be eligible for a free flu vaccine as well. But check the NHS website to see what is available and who is eligible. Finally, get advice if you're feeling unwell. If you're age 65 or above or in an at-risk group, please seek medical attention as soon as you can. You can get help and advice from a pharmacy in the first instance. Pharmacists can give advice and treatment with minor illnesses, and if needs be, they can advise you to see a doctor if it's something more serious. Your GP, of course, via a phone or a in-person appointment. If it's something more urgent, you can phone 111 for advice and speak to an operator on that call. If there's an emergency medical situation that you need to have some serious attention, make sure you call 999 as soon as possible if that requires immediate attention. And of course, all of this means the sooner you get advice, the sooner you get more likely to feel better. And then finally, We've got a range of links that will be included in the resource pack that we'll be distributing with this presentation. This includes information about winter advice and support, keeping warm this winter, staying well this winter, and the flu and COVID vaccines. So thank you for listening to today's presentation, and we'll hopefully see you next week for the next edition.